Okay, let's call to order the Humboldt County Board of Health meeting for Thursday, June 4th, 2020. It's 9 a.m. And our first call to order is for the Pledge of Allegiance. Will you join me?
And 1 second here, I'll get you some.
Okay. I pledge allegiance to the flag of the United States of America and to the republic for which
It stands.
one nation, under God, indivisible, with liberty and justice for all. Thank you. Okay, now our first order of business is first public comment. Is there anybody that would like to make a comment in the public? If you do, and you may be on mute, please hit *6 to unmute yourself.
Madam Chair,
Yes.
before we do that, would you go ahead and take a roll call?
Okay, I sure will. Okay, Jim French, are you here?
I'm here.
Okay, Mike Bell.
Here.
Ron Cherry. Okay, Ken Tipton. Okay, Dr. Stringham.
I'm here.
Okay, and I believe Kevin Malone.
Madam Chair, I don't know if Kevin's going to represent the sheriff. However, the sheriff got called away on an emergency, so he just left the office.
Sheriff is gone, and Kevin, you're here, it looks like.
Yes, Kevin Malone, Under Sheriff here.
You're unmuted.
I will call Sheriff Allen real quick and see if there's anything I need to add.
Okay, thank you. And I'm here, Marlene Brissenden. Okay, next, like I was asking, is there public comment? If so, please *6 your phone and please make a comment if you have one.
Commissioner Brissenden, can you hear me? This is Wendy
Yes.
Maddox.
Yes, Wendy.
Can we pause for a minute? I just want to make sure that we have a quorum.
We do.
We have,
Okay, perfect.
We
we have
Thank you.
three
We have
commissioners.
Four
Three
commissioners.
and Dr. String.
Okay, thank you. I just couldn't see everyone. Thanks.
This is Commissioner Cherry. I had to join using a phone.
Okay, and Ron is here. Okay, so our first item is update from the public health official, local officer, local emergency manager, public information officer on county response to the COVID-19 coronavirus. For information only, a presentation by Dr. Charles Stringham, public health officer, Captain Sean Wilkin, Humboldt County Sheriff's Office, and local emergency manager, as well as Nicole Maher, public information officer, regarding the current status of the Humboldt County response to the COVID-19 virus, including but not limited to the latest number of positive cases in the county, as well as updates regarding other efforts to mitigate the spread of the virus. In addition, the group will update the board regarding the dissemination of information to the public through various methods. Information only. Okay, Dr. Stringham.
Well, good morning, everybody. So this morning, my presentation is actually fairly brief. Most of you will probably be pretty happy to know that. Part of it is because there's really not as much going on as there had been. I'm very pleased about that. So the first I'd like to be able to say is that our thanks go out to the people of Humboldt County. The reason is because everybody is doing enough of the right things that we've had a wonderful response with this virus. And in the last 7 days, we've had only one new case. In the last 14 days, we've had only 2 new cases. And I think things are going the right way. I'm really pleased with what's happening here for a lot of different reasons. So in terms of where we stand now, we're officially at 78 cases. And some of you may realize that last week we had 78 cases also. And the reason for this discrepancy is because one case was added. It's a gentleman in his early 60s, and but one case was removed, largely for bookkeeping reasons. And so the case that was removed was a gentleman who came from North Carolina, and it was one of the first wave of cases during the first couple of weeks of the virus here in Humboldt County. So one added, one removed, and in general, things are going very nicely, I think. So only one hospitalization in the last 4 weeks. I was very happy about that also. And so things really are going the right way. Again, I'd like to thank the people of Humboldt County, the various agencies, emergency responders, Humboldt General Hospital, and all of the other folks who are working very, very hard, making the sacrifices, doing the right things, and doing things that in a lot of cases aren't very pleasant, but are necessary to accomplish what we've accomplished here. I'd also like to specifically thank our various law enforcement agencies, Humboldt County Sheriff's Office, the Winnemucca Police Department, NDI, Nevada Highway Patrol. And the reason is because a lot of the things that we're seeing around our country these days have to do with relationships that law enforcement and constituency, the citizens, have. And I'm so pleased that our law enforcement agencies have wonderful relationships with the citizens here in Humboldt County. There's great understandings by both law enforcement and citizens. And so we're not seeing a lot of the negative things that are going on around the nation these days. I'm very happy about that from a COVID standpoint, because I expect that there may be a spike in many communities over the next couple of weeks as a result of the mayhem. And I think that Humboldt County does a lot of things the right way. And this is just another example of a place that we're all going to really enjoy where we live. I'm very pleased about that. We're seeing some other tangible evidence that things are going well in Humboldt County also. And one of those things is that the FAST team, which is comprised right now primarily of 3 individuals, we have a couple of others who are less active, but are also on the team, but our 2 primary team members, I've had dialogues with both of our law enforcement agencies who've contributed membership to the FAST team. And we're in the process at this point likely of cutting back on the FAST team so that those agencies can benefit from the employees that they've donated to our team. And they'll still be members of the FAST team. The FAST team is still in effect, and we still have the capacity to do everything we need to do. But because of fewer cases, this week, for example, just the one case and was associated with 32 individual contacts. And so the team has been busy doing various things, but not as busy, thankfully, as they had been in the past. That's also a really good thing. Humboldt General Hospital typically has a daily meeting every day of the week, specifically with respect to COVID capacities, and current status. I was very happy that last week the hospital was able to go back to 2 meetings per week, which is also another indicator that things tangibly are going really well. I'm really pleased with our response. I have a couple of areas of concern that I wanted to discuss too. One is that as the number of cases we're seeing in our county has dropped, the compliance with mask wearing and social distancing is also starting to go down. I'd like to let everybody know that while people are doing a fantastic job, and that translates to more liberties, more abilities to do the things that we want to do, it should not translate to a lack of caution. So we have this virus on the run. I think a lot of things have gone the right way. People have really done well. But I'd caution you at this point, it's very important, all members of the community, to realize that this is not over, and this could rear back up again. Also, in cold weather during September, October, I would anticipate that it likely will rear back up again. So we've got to be prepared, vigilant, and realize that we can't rest on our laurels. Things have gone very well, but it's important that we continue to do the right things. The antibody program that I talked to you about last week, very excited about that. I'm cooperating at this point with a friend in Rena who does infectious disease, and she is also assisting us to come up with our specific experimental protocol for randomization. And so this is still in the works. We don't know exactly how we'll finance this program, and we're still potentially looking into other various options. If there's any companies that would like to make a contribution, it would be very, very appreciated. And please call either Mr. Mendiola or me here in the office, and I'll be very happy to talk to you about this. Very excited about this program. Paige Brooks and I had spoken briefly this morning, and I always like to put a little bit of basic science into the presentations that we give, because I think people are interested in this. And Paige's question had to do with masks, and she's hearing a lot of questions from some of the people she's in contact with about masks, how effective they are, and I'm hearing a lot about this too. So I just wanted to take a couple of seconds and talk to you a little bit about masks and give a little bit of information. We've talked a little bit in the past, but I want to give a little bit more detailed information about this, and then we'll close. So the first is, do masks really help? And the answer is resoundingly yes. We've talked a little bit about the fact there's been a lot of ambiguity in masks. Part of this is because in the early days of the fight, there weren't as many masks to go around as we needed. And so the federal government, specifically through Dr. Adams, the Surgeon General, and also Dr. Fauci, had made a comment in passing that was largely taken out of context when it was shared on the internet. And both of them were touted as not supporting masks, not liking masks, and not being impressed by masks. And what I can tell you is both of their comments were largely taken out of context. Dr. Adams is very knowledgeable, and he absolutely does support masks. He was just concerned about taking them away from emergency management response. And the other is that we seem to have a counterculture that has crept up, and they're using what I call pseudoscience, which means that they make arguments that when you listen to them on a surface level, they make sense. But then when you explore them a little bit more deeply, the arguments seem to fall apart pretty quickly. And the example that I came up with is one that's kind of curious, but work with me on this because it works for me anyway. And that is a person could legitimately make the argument that bears are not dangerous to us because the size of a bear's mouth is much smaller than a human being, and it actually sounds legitimate. It's the argument makes sense. And you could legitimize that by further explaining that we've measured bear mouths and human beings very, very accurately. And we have thousands of people who've been involved in this experiment, and we can prove this. So what's happening is we're disguising the fact that the basic premise is stupid, and we're disguising that with facts that, while they're true, really don't support the conclusion. If you had thousands of different measurements of people and bear mouths, it would make it seem legitimate. But the bottom line is anybody who's ever seen the way a bear attacks understands that the bear doesn't need to swallow you in order to be dangerous. So the basic premise of the argument is stupid, it's ridiculous. So one of the arguments that's being made is that the individual viral particles are small enough that they can easily make it through a mask. And with N95 masks, that is absolutely not true. So N95 masks are designed so that those viral particles do not go through those masks. And but cloth masks, the so-called medical masks, surgical masks, dust masks, things of that nature, they work in a slightly different way. And so they do not work the way a screen door would help to keep pebbles out of your house. Screen doors would help to keep small pebbles and stones out of your house, but they wouldn't help to keep dust out of your house. That's true. But that's not actually the way that the masks work. They work more the way that a towel might allow a small amount of talcum powder to get through, but enough of the talcum powder sticks in the bath towel that you wouldn't really have to worry about very much of it getting through, if anything at all. Theoretically, the particles of talcum powder can make it through the towel, but for all intents and purposes, it doesn't really work that way. So that's really more the way that medical quality or dust masks or surgical masks are working. So the basic premise that masks don't work is absolutely false. The other argument that I'm hearing is CO2 narcosis. People are breathing the same air in and out of the mask, and they can pass out, and it's very dangerous. And that's absolutely not true. If you were to have a mask that were quite large that came all the way out to here, yes, that's absolutely true. The way that a snorkel that's 15 feet long wouldn't actually work. You're just breathing the same air in and out. And that's one of the reasons that masks are as small as they can be, because that concept of CO2 narcosis, it's been thought of, and not a legitimate argument. Some people don't find them comfortable, and that's true. Some people really do have respiratory illnesses for which they can't wear a mask, and I respect that too. As long as most people do, then we're okay. And the final argument is that we're weakening our immune systems, and that's not true. COVID-19 is very dangerous, and we want to be able to prevent this. we're not preventing all viruses, and our immune systems have already been around for many, many years, and a couple of months of wearing a mask is not going to change what your immune system is capable of doing. So I'd be happy to answer any specific questions during the question and answer session of our meeting later, but rest assured masks are good, and they're one of the reasons our community has enjoyed some of the benefits we have. So in closing, I'd like to say that we're in the process of changing the nature of the fight. In the beginning, things were being learned very quickly. People were engaging. We had a lot less on our plates than we do these days. And I'd like to draw your attention to the fact that in the future, it'll be very important for each of us to keep our eye on the ball, because as there are more balls that we have to juggle, it's going to become more difficult to focus on what's important. So critical things have not changed. The three most important things that we do: hand washing, face mask wearing, social distancing, and critical that we do those things. So very happy to be involved in this fight. I'm very happy that we're winning and things are going well. I'm enjoying working with each of you, and thank you very much for your time.
And thank you, Dr. Stringham. Now, my fellow commissioners, do you have any questions for Dr. Stringham? Jim French?
Thank you, Madam Chair. Dr. Stringham, I too, I thank you very much for your role and your leadership in this. You have really served this community as you always have, and I'm proud to serve next to you. I was wondering, Dr. Stringham, do we have any indication as to when we might be starting the community-wide testing, or the random testing rather, for the antibodies within the community?
I'd like to do that during the next 2 weeks. And the situation at this point, there are two, not snags, but two things that need to be ironed out first. The first is how we'll pay for this. And so I'm in the process right now of looking into various options, and I know Dave Mendiola is too. And so we're trying to do a couple of different things to finance this. The price we think will be between about $5,000 and $6,000. And then the other is I'm working with a specialist who's a friend in Reno. She's an infectious disease specialist, and I want her assistance in designing better randomization. And so the two of us are working on that at this point. One of the reasons that randomization is so critical in this experiment is because the numbers that we're going to be testing is very, very small, 84 people. It's a 0.5% of the citizens of Humboldt County. And so with very, very small numbers, just like with the navigation, if you're off by just a couple of seconds of latitude, when you extrapolate that forward thousands of miles, the distance that you're off is much, much greater. And so my concern is that if we could test a larger number of people, then the randomization wouldn't be so critical. Our measurements wouldn't have to be as accurate. But because the measurements that we're making are so small, randomization is critical, and we're trying to figure out exactly how we're going to match the people who theoretically wouldn't want to have their blood drawn with other people who would be of a similar nature, similar demographics, similar age, similar risk factors and things. So that's kind of those are the two holdups at this point. But I feel very confident that we'll be able to do that within about 2 weeks.
Great. And one short follow-up question. Last week I asked about the cost of providing the antibody test through Humboldt General Hospital, and whether or not people, if people present and ask for that testing, will the charge be at $50, similar to what the county will be paying for this test?
I see Tiffany on the meeting this morning, and I'm not sure if she may be able to answer that question, or if one of the other folks at Humboldt General can. My presumption would be that if somebody presented directly to us to the randomized test program, we would be able to test for $50 plus the blood drawing fee. And if somebody were interested in being involved in the experiment, in other words, to volunteer, what we could do with that person is also offer them the $50 fee, as long as we could exchange that person with somebody who didn't want to be tested. So those folks who present spontaneously and say, I was not called randomly, but I'd like to volunteer to be part of this program, those people can't really be part of our experiment, but they could be used as alternatives. And so if that person can match the demographics of the person who originally was chosen, but then opted out, we could have that person essentially self-select, but yet still be part of a randomized program. And that would be a way that they could enjoy the $50 fee. And at this point, maybe Tiffany can answer the price that Humboldt General charges for IgG or IgM testing for antibodies.
So actually, let's see.
Oh, you're on mute, Tiffany.
Whenever I try to talk, it echoes.
Tiffany, I think you're getting feedback. If you turn your speaker all the way off, I think we'll be able to hear you.
How about now?
Yeah.
Sorry.
I'll
Are you
type
done?
it.
I think Mike is going to try to help, Tiffany. I
Yeah,
hear you, Mike.
Yeah, if you're dialed in and you're on the phone, one of them has to mute. So if you're on the phone, you can speak through your phone, but you've got to mute your speakers on the computer. That's what it sounds like to me, is your computer speakers need to be turned down or off.
Nope, you're on mute for the.
Tiffany, what we can do also is if you text me, I can share what you'd like to say. Maybe we can move on to a different topic, and then I can come back to that, Commissioner French, on maybe in a question and answer session a little bit later, if that's okay with everybody else.
That'll work fine. Thank you.
Excellent.
That sounds good. Okay, Commissioner Cherry, do you have any questions for Dr. Stringham? Ron, are you there? You may need to unmute your phone.
Hello?
Okay. Oh, there you are. Good
Okay.
job, Ron. We hear you.
I had to hit *6. My mute didn't unmute. Okay.
Okay.
Thank you, Dr. Stringham. Thank you to the whole team of people out there that have been working on this virus. We're finally seeing results, and much of it is due to your efforts. So, and I want to thank you for the community and as a county official. I want to ask one simple question, and is, we are seeing that the number of positive cases drop drastically. How are those numbers on those that would be considered recovered? Are those coming down exponentially as well, or how is that going?
Yes, in fact, I had spoken with the FAST team this morning specifically about the issue of recovered cases. And so the specific method that's used is that Humboldt General, through two specific people, our infection control nurse and also the community paramedicine program, are the ones who are actually responsible for defining who's recovered. And so we have a total of 19 who are recovered so far. We're anticipating that number will increase. And part of it is that we don't consider somebody to be recovered until they have no further symptoms, they are out of respiratory isolation, and they're kind of back on with their lives. So the number 19 is not a very large number, especially compared to the 78 or 79 cases that we have so far. And what I would say is, from my standpoint, I haven't been overly worried about it, because to me, the recovered number is the number of potentially recovered patients, those people who either are recovered or will recover, is the number that we've had total, which is 78, and subtract the number of people who've passed away, which is 4. And so we have a potential for 74 of 78 cases to either be recovered or soon be recovered. And so I know that in the near future, that number will go to 74. As we've released people from respiratory isolation, the number is going to be going up very quickly. Our criteria for releasing people has changed. We talked a little bit about that last week, that we no longer do 2 consecutive negative tests. We now release people from respiratory isolation based on their time. So it's 15 days of from the time that the test was done, and in addition, no symptoms. And so my anticipation is that by next week or the week following, the total number recovered likely will be in the high 60s, I would guess. And then eventually the total number recovered will absolutely be 74. Will be the number here within probably about 3 weeks, I think.
So if I understand, you're right. You don't need to be considered recovered to be able to get back out in society to not have to self-isolate anymore. Is that right? Just the 15 days?
That's a good question. The answer is you do have to be considered recovered in order to go back out into the community, because recovery would include, recovery previously would have included 2 negative tests, but no longer does. And then recovery would also include, at this point, at least 15 days from the time the positive test was realized, was done, and have no symptoms whatsoever. In short, what I think is the total of 19 cases that we declare as having been recovered is not actually an accurate number in terms of the number of people who have recovered in terms of no symptoms and either time has elapsed or negative tests have occurred. So as I said, I suspect that number is going to go up quite a bit over the next week or so. My anticipation is that by the time that we meet next time, probably that number will be at least 55 or so. 50 or 55 is what I would guess.
Okay, thank you.
Okay. Mike Bell, do you have a question for Dr. Stringham?
No, I don't have any questions. Just want to say thank you for all your work that you're doing, and we'll just keep up what we're doing. I appreciate everything you're doing. Thanks.
Okay, thank you. I think we will go on to, I don't think Captain Sean Wilkin is here, but it looks like Sheriff Mike Allen is here. Would you like to give an update, Sheriff?
Yes, please. And also I want to echo the same comments that everybody else has made. Thank you, Dr. Stringham, for your knowledge, expertise on this. We couldn't have done it without you, and I really like the progress the community is going right now. And also assembling that FAST team, I think that was critical on help control this COVID. So yes, Sean Wilkin, Captain Wilkin is not available today, but yesterday, I don't know if any of you were on it, but there was a conference call by the state where Caleb Cage, who is the state of Nevada COVID-19 response director, held a conference call at 11 o'clock yesterday. However, this agenda was sent out to throughout Nevada, and it capped off at 100 people. And by the time we called in, we were shut out. So we've been trying to follow up with the Division of Emergency Management to get updated on it. But shortly before this meeting, I sent all the commissioners an email what this conference call was about. And the state of Nevada developed and published a disease outbreak management strategy and concept of operations plan. That should be in your email now. And just a brief summary on it is what it discusses in there is that Governor Sisolak announced the approval of a comprehensive community-based testing, laboratory analysis, and contact tracing plan to support local, statewide, and tribal efforts to reopen and keep open the Nevada economy. And it goes into further, they want to update on testing. Now, I don't know if this includes the antibody testing, contact tracing, and a funding plan for the entire state. Once we receive more information on this and we're able to contact the Division of Emergency Management, we will update everybody on that. And then the only other thing that I have to add is we have a lot of people involved, and I do want to send our thanks and appreciation out to Marcia Foreman, who has also been an integral partner that we've had throughout this whole pandemic. So once again, I just want to thank Marcia Foreman for all the work that she's put in on the pods, and without her expertise and the way she runs these flu pods, I don't think we would have been as successful when we did the community-based testing. So thank you, Marcia.
Okay, Sheriff, thank you. Nicole, it's time for you to let us know what's going on. And if you can hear us, *6 if you're on mute.
Madam Chair, she's there. I just don't hear her yet.
Okay. Okay, Nicole, are you hearing us?
Good morning. Can you hear me?
Yes. Hi,
Okay.
Nicole.
Hi there. I'm so sorry. This is my son's little computer microphone. Sometimes it takes a while. Well, good morning. It's great to hear all of this good news and good questions. This past week, as Dr. Stringham said, things are slowing down and hopefully we're normalizing a little bit. As we've moved into phase 2 as of the 29th of May, it's been important on our end to help our community know that businesses are open. That is our primary concern, of course, in our county, is supporting business and helping to shore up that tax base. And so we want to let people know that businesses are open and that they can take part in that commerce in a safe way. So we've shared some information and continue to do that. It appears that in just listening to what our community is saying, that they seem to be pleased that casinos have the opportunity to reopen starting today, and they feel that's a positive sign for our community, for our economy. One of the things that has been interesting to me is, and perhaps something that I will continue to focus on a little bit, is that there's been a bit of a backlash that our county isn't doing enough to open business, and just issuing gentle reminders to our residents that Humboldt County is following the state's guidelines for business reopening statewide, and that we don't act as mavericks in that. We certainly operate within those guidelines, and so that's important for people to understand as well. We've been working on creating a list of frequently asked questions. Those are important now, but they'll also be important, as Dr. Stringham said, as we see maybe a more seasonal activity with COVID in the future. And certainly some of those same questions and answers will come up. The most frequently asked questions that I get are about contact tracing and recovery, which, as we know from these meetings, is always an interesting topic. And Dr. Stringham has spoken about recovery going from the testing based to more of a time symptom based, and that's been important to help our community know more about that and how that process is taking place. A little bit of misconception on the part of some people that have been trying to fix this week is they believe that when I announce the number of cases, that particular number should be coming down. And so just helping them know that we are at 19 recovered now, up from 13, and so we are making progress in that. As Dr. Stringham said, one of our concerns is just the reduced use of masks and social distancing. And just anecdotally, I've seen that as I've been in stores and just around town. And as the sheriff noted, as more Nevada businesses reopen under phase 2, Governor Sisolak has announced that 3-pronged plan. And one of the goals of that plan is to perform COVID-19 testing on 2% of the state's population each month. So that's about 60,000 tests for at least a year. And so as the sheriff noted, we don't quite know what that looks like, and I'll wait for guidance from emergency management from Dr. Stringham. But the idea is to detect outbreaks quickly enough to contain them before we have to go back to shutdowns. And I don't know what that will look like for our county residents, but I'll certainly stay in communication so that we can share appropriately what our 2% will look like each month and how that will be accomplished. I just wanted to give a shout out to the Mukka mask makers during this really amazing time. So the numbers that I have right now are several days old, but as of a couple of days ago, they were at 5,641 masks. And I know that there are more, but I just want to give a shout out to Leanne Robertson and that group for their continued efforts. And just want to remind people to continue wearing masks. The Mukka mask makers have a stock of masks available at Ridley's Pharmacy and Olson's Pharmacy, and people are welcome to stop by there. The county also has masks, and we've seen some of our churches reaching out to get some masks, and Dave Mendiola has been great about sharing those. And I'm not sure if Marcia's on the phone, but she shared her numbers with me the other day. I just thought it would be interesting for you to know that during the community-based testing in Lovelock, which Marcia also oversees.
Yeah, Marcia is here.
Oh, okay. Marcia, do you want to share those numbers from those testing sites?
Okay, so we were able to do 193 with the National Guard in Lovelock at the community center, and 17 out Grass Valley. As of yet, we've had no positives come back, so that's a very promising sign that there are no positives in that community-based testing either. And I also wanted to say thank you to Sheriff Allen. I just didn't want to interrupt. And if there's any other questions?
Are there any other questions for Marcia Foreman?
Madam Chair, this is Commissioner French. I just was curious as to what the total number of tests that were administered in Winnemucca and the rurals, as well as Pershing County.
Okay, so there was 210 in Pershing and 721 in Winnemucca. And I'm not sure of the numbers available. I can find that out for next meeting because they did it also. And Elko was happening the same time that we were happening in Lovelock. So I can also get those numbers if you'd like. And the good news is, out of 100 plus tests, we only had one positive. So it shows everything that Dr. Stringham has been working towards, everything everyone in the community has been working towards, is working.
Great, thank you.
Mm-hmm.
Thank you, Marcia.
Mm-hmm.
Okay, Nicole. Are you there, Nicole?
I am. Can you hear me?
Yes.
Okay. Thank you, Marcia. And I was just going to mention, as of the state statistics, the latest ones that came over this morning, and I know sometimes these are just a sketch far behind because I know our numbers sometimes are, but Lander has 21 positive cases right now. Pershing actually has 2 cases, and of course Humboldt, we stand at 78. So that's our Tri-County. I'm happy to answer any questions that anybody has.
Does anybody have any questions for Nicole?
Madam Chair, this is Commissioner French again. I just trying to write down all these statistics. And Nicole, I was wondering if you had any information as to the results from the community-wide testing out of Elko County.
Nicole, did you hear that question from Commissioner French?
I did. Can you hear me okay?
I can now.
Yes.
Okay, I'm sorry. I do not, Jim, I'm sorry. I actually was on the phone yesterday with Terry Clark, who is my counterpart over in Elko, and we talked about the community testing, but I did not get those numbers, but I'd be happy to. Oh, actually, I am sorry. She did not have those numbers now that I think about our conversation, but she probably has them today, and I'd be happy to get them from her and shoot them over to you if you'd like.
Great. We could, if you could just provide that as part of your report next week, that'd be great.
Yeah, you betcha.
Thanks.
This is Marcia, and I just wanted to let you know a little bit about Pershing, what's going on there. So as of right now, they have 3 positives, one who's being retested to cancel out, hopefully, and they have some happening in the prison. So they are working very hard on getting the prison tested right now. So just so everyone is aware of that's happening.
Thank you, Marcia. Okay. Nicole, are you done with your presentation?
Yes, that's all I had for today.
Okay, thank you very much, Nicole. If there are any questions for Nicole or anybody, we will come to a public comment period at the end of the meeting and we can chat more about it at that time. Our next item is testing update. Consideration, discussion, and possible action regarding several ongoing testing activities that may be conducted as part of the overall economic reopening plan, including but not limited to antibody testing and ongoing community testing in the months ahead. So for discussion and possible action, who would like to chat about this? Or have we already chatted about it, Dr. Stringham?
Yeah, I think we've already chatted about that. So we've talked a little bit about the 2% per month testing, the status of the antibody, community antibody testing, and then Marcia and Nicole talked a little bit about the community-based, initial community-based swab testing. So yeah, I think we're good unless anybody has any specific questions about it.
Okay. Are there any questions? Star 6 if you do. Okay, I will, or is there anybody that has a question?
Madam Chair, Dave Mendiola, I would also
Yes.
just remind you, as Sheriff Allen mentioned, the state has now released a plan for that testing. We got it late yesterday, but I went through it a little bit last night, and it does have kind of fills in a lot of the gaps that we had and questions we had about how would we test on an ongoing basis. So haven't really dug deep into it yet, but I think that's a good start. So we'll know more on that here as the days go on and for next week probably.
For the next meeting. Great. Thank you, Dave. Okay, the next item is follow-up review and discussion regarding phase 2 of the opening of the economy. Consideration, discussion, and possible action regarding the opening of non-essential businesses in phase 2 of the road to recovery, which begins on May 29th. I believe we've already done this. But is there any more discussion on this item, Dave?
Madam Chair, again, I think generally speaking, the success rate so far has been excellent. I have heard back from several businesses since we got our masks in finally. I've been delivering masks, and when I did that, I had an opportunity to talk to different owners and managers, and everybody, is kind of just falling right into line in terms of the preparation and the protocols they're using. So I think so far so good. The biggest problem is that if you're in one of those business, as I was talking to Paige Brooks this morning, and you have to wear that mask all day long, that's a painful process. It just in the sense that it causes problems with, breaking out of your face and things like that. So anyway, it's you got to find the right mask for the right situation. But in general, my senses and talking to our local business people is they're very excited, and especially now our casinos, since they're going to get opening starting today.
Okay, good. Commissioners, are there any questions regarding that item?
I
Okay.
have none.
Oh, okay, sounds good. I hear somebody. Does somebody have a question? You're kind of going in and out. Okay, we can't hear you right now, but at public comment, we may be able to, you may be able to get through better. I'm not sure. I will ask again at that time.
Madam Chair.
And yes.
Dave Mendiola, if that individual trying to get in wants to send me a text at 775-376-0409, 376-0409, I'll be happy to repeat that.
Okay. We will wait a minute to see if that person texts you, Dave.
You may want to just move on, Madam Chair, and I'll interrupt.
I sure will. I sure will. Next item is status of plan to open county offices to normal business. Information only, a discussion about plans to return county offices to normal operating procedures in light of the positive trends in COVID-19 cases, as well as other factors.
Madam
Hey,
Chair,
Dave?
Dave Mendiola. So next week, next Wednesday, the Humboldt County Management Team will gather for our annual monthly meeting. There's been a lot of work in the background. We asked them about a month ago to start thinking about that, of how that would look. We do have some guidance from both OSHA and CDC on that front. The main thing that we're waiting for right now is we have ordered some plexiglass windows, if you will, that we will be installing in those areas where we currently don't have glass. For example, Justice Court, District Court, and several others. So the Sheriff's Office, for example, do have glass already, so they're pretty well equipped for that. Some of the more open areas in our county offices, we don't have that. So we've got some things ordered. Once we get those in, they'll be in place. So right now, it would be my guess that we're shooting for the end of June, first week in July, to do that. By then, we should have those in place, unless we get back ordered and those things are not available. It's my hope that we would still open. We would just have to come up with a little different arrangement, but the plan is to get the offices back open.
Okay, and I believe Wendy Maddox sent the commissioners a Directive 21 about reopening. District Attorney or Deputy District Attorney Wendy, do you have anything to comment on that?
This is Wendy Maddox for the record. I really don't. I think there's as you all read, you're aware that the directive is following some of the directive and directions that have given to non-essential businesses and hair salons and that sort of thing. So I think there's going to be some duties on the part of the employer of Humboldt County to do some of the things Dave's talking about, create physical barriers. The departments are going to need to continue to social distance. And I think there needs to be a plan in place for, if possible, for employees that are from a vulnerable population to be able to remote work or that sort of thing. And that's all covered in the directive.
Okay, thank you. And do we need, Wendy, to have that put on our county commission meeting to be approved to reopen?
Yes, if that's what the commissioners would like to do, we can put it on a future agenda and you guys can make a decision at a meeting and take action.
Okay,
Currently, the plan is to have that on the June 15th meeting.
gotcha. Thank you, Dave.
At least we'll give you an update as to where we are if we don't know an exact time and date. So,
Okay. And thank you, Wendy.
You're welcome.
And are there any questions regarding this item from anybody? If so, *6. Your phone.
Madam Chair, while we're waiting for that, I would like to just reiterate that the county offices have always been open. They were never closed, but we did lock the doors and allowed only single point of entry. And then we did work with all of our departments. We're meeting citizens in that lobby to exchange documents and different things. So that's been, I think, very successful. Haven't really heard a lot of feedback, that there's been any problems with that. It is a bit of a hassle, but it seems to have worked pretty good, and we'll continue to do that until we can get some of those physical barriers in place and that type of thing. But we have been open.
Good. Thank you, Dave.
Commissioner Cherry, can you hear me?
Yes, we can, Ron.
Dave, when we get back to normal in the county offices, would our commission meetings resume again also in the courthouse, and the public be allowed to attend?
My answer to that would be yes. I think that the biggest problem is just we'd have to set up the room so that we would have social distancing in place. But in terms of, the distancing for our current setup for the commissioners, we pretty much got the room that we need to do that today. The City Council Winnemucca has been doing both, I think, virtual as well as an occasional in-person meeting. So that would be our goal as well, as to maybe shoot for the July 6th meeting, or possibly maybe later that month at the second meeting. But yeah, we would just have to arrange the seating to make sure that we would only allow, seating with the proper distancing.
Okay.
I believe that the numbers for gatherings have gone from 10 to 50. So yes, it's just a matter of being able to do the social distancing and in our meeting room.
This Commissioner Bell, I think like Commissioner Brisnan stated, the 50 people. However, I think you have to still do both, as if we have over 50, you violate open meeting laws, I would assume.
Hi, and this is Wendy Maddox, Deputy District Attorney. Just for purposes of contributing to this conversation, I do want to let you know that according to Directive 21, you're correct, Commissioner Bell, the physical location for a meeting, that requirement is still suspended. So I think you would be able to, do a mixture of both, have some commissioners and some public in the meeting room, but also still provide a way for the public to join electronically or through the internet.
Okay, thank you. I believe we are on to the next item, which is future agenda items and next meeting date.
Madam Chair, Dave Mendiola. I think what we'll do is we're going to keep the testing agenda item on there. Obviously, Dr. Stringham mentioned he's going to follow up with more specifics on the antibody testing once we get some of those specifics ironed out, as well as those costs and how that's going to be funded. So we'll keep that on there. We'll keep our normal information on there. And then, again, I would put a message out to anybody if there's a recommendation for an item, please, again, you can contact me, dave.mendiola@humboldtcountynv.gov, or call the office 775-623-6300, and we're happy to consider any items for this meeting.
Okay, thank you, Dave. I believe the next meeting will be then Thursday, June 11th at 9 a.m. And so now I will go on. Oh, is there a question? No. I will go on to public comment. Is there anybody in the public that is interested in making a comment at this time? The public has the opportunity to address the commission on any matter not appearing on this agenda. However, no action may be taken on a matter raised until the matter itself has been specifically included on the agenda as an item upon which action may be taken. So if there's anybody that has a question, *6 your phone or unmute.
This is Marcia Foreman. Can you hear me?
Yes, Marcia.
Okay. I was just wondering if Tiffany had found out that price for Humboldt General Hospital. I know I have a ton of people calling the office and asking, and I have no information for them.
I think she texted it to you, Dr. Stringham.
Yes. Yeah, it sounds like there's some concerns about the sensitivity and specificity that the hospital pathologist has at this time is kind of what Tiffany had indicated. And so just read over the rest of this. Yeah, it sounds like there's some concerns about sensitivity and specificity, and so the hospital is going to be looking into that a little bit more. And then what I can do is I can provide an update on that when we visit next time, so I'll be able to answer that question a little bit better. I'm kind of interested to know that the answer to the question myself, and I can also reach out to Dr. Mardini, is the pathologist that Tiffany had referenced. He's a great guy and very knowledgeable about this. And it'll be easy for me to just talk to him and figure out what we can do. And I can also potentially help the hospital with acquisition of better testing processes and things.
Thank you.
Thank you, Dr. Stringham. And thank you, Tiffany. Appreciate it. We're sorry that we weren't able to communicate effectively with you, but thank you.
Madam Chair, this is Commissioner French.
Yes.
Just a kind of a follow-up on that as well. If we could get a report as well as to when the testing is being, assuming it will be, but assuming when the test is available through HGH, if they could provide us with information as to what the cost would be to those members of the community who have an interest in being tested.
Okay, and Commissioner French, I can actually follow up on that during next meeting too, so I can take that question.
Great. I'm getting a lot of questions along that line. Thank you.
Good. Is there any other questions? Are there any other questions at this time? If so, *6 or unmute. And if not, we will adjourn this meeting at, it looks like my computer says 9:59 a.m. And I thank everybody for your attention and your participation. And everybody have a great day. Thank you.
Thank you.